Imagine it's 1650. You have a pounding headache and a fever. You go to a local professional, but he does not give you aspirin. Instead, he rolls up your sleeve, finds a vein, and says, "You just have too much blood." For 2000 years, this was top-tier medicine. If the illness didn't kill you, the cure often did. But how did we get from leaching your humors to robotic heart surgery? Today, we are traveling through time to meet three patients in three different eras to see the terrifying, messy, and miraculous evolution of surgery. Meet Thomas. Thomas has a problem. His leg is infected, and in 1750, that's a death sentence unless it comes off. Thomas is held down by four strong men. There is no anesthesia. There is no sink to wash hands. The surgeon, wearing a frock coat stained with the blood of yesterday's patients, picks up a hacksaw. The key medical concepts in that era: the humoral theory, the belief that health was dictated by four fluids: blood, phlegm, yellow bile, and black bile. Speed is king. Surgeons were judged by how fast they could amputate. A leg could be off in just under 30 seconds. The miasma myth. People thought bad air caused disease, not germs. Surgeons didn't wash their tools because, well, blood is just blood. Thomas survives the surgery, but dies 3 days later from hospital fever, sepsis. Back then, the hospital was the last place you wanted to go. It was where you went to die. But a sweet gas was about to change everything. Fast forward to 1890. Clara has a sharp pain in her side. 50 years ago, she would have been given opium and a prayer. But Clara is living in the golden age of discovery. The operating theater is cleaner. The surgeon, Dr. Lister, is spraying a fine mist of carbolic acid into the air. He's wearing gloves. Clara is drifting off to sleep because of a rag soaked in ether. In this era, three game changers were there: anesthesia, antiseptics, and x-rays. In 1846, for the first time, the body wasn't a screaming obstacle. Surgeons could slow down and be precise. In 1860s, Joseph Lister realized that invisible germs were killing people. He started cleaning wounds and instruments. In 1895, for the first time, doctors could see inside the body without cutting it open. Clara wakes up. Her appendix is gone. She is sore, but she's alive. The mortality rate for surgery plummets from 80% to under 10%. Finally, we meet Leo. In Thomas's time, Leo's heart would be a mystery. In Clara's time, it would be untouchable. In 2026, it's just a Tuesday morning. A bright, sterile room. There is no large saw. There isn't even a large incision. A surgeon sits at a console across the room, moving joysticks. The modern era gave us the modern toolkit, including robotic surgery, laparoscopy, antibiotics, and genomics. The Da Vinci system translates a surgeon's hand movements into micro movements of tiny tools inside Leo's chest. Instead of a 10-inch scar, Leo gets 3 tiny dots. All credit goes to laparoscopic procedure. We don't just guess the medicine, we tailor it to Leo's specific DNA. Leo is home within 48 hours. He's eating toast and watching the news. We have moved from the blade of a barber to the laser of a robot. In the future, we are looking at 3D printed organs and nanobots that repair cells from the inside out. The next time you walk into a clean, quiet doctor's office and complain about the 15-minute wait, just remember Thomas. At least, no one is coming at you with a hacksaw and a bowl of leeches. Stay curious, stay healthy. See you in the future.